Neck relief in under 5 minutes. Can't turn your head without pain? I'm Dr. Clayton with Empower Health Performance here in Orange County, California. And if you've ever woken up with a stiff neck, unable to look over your shoulder without a jolting pain, this video is for you. Today, I'm going to walk you through a simple, effective routine I use with my patients every day to relieve neck tension, whether it's from muscle tightness or nerve irritation. These exercises are especially helpful if the pain is on one side and stubborn. But before we jump in, let's talk about what's actually happening. This muscle right here is your levator scapula. Runs from one side of your neck down to your shoulder blade. If you're just feeling tight or sore, it's likely the muscle is simply just tight. But if you have more pain, maybe a severe traveling down along your shoulder blade, sharp stabbing pain, maybe just throbbing next to that shoulder blade, it's more likely this nerve that's irritated. That's why this routine targets both muscle and nerve. Let's dive in. The first thing we're gonna do is bring blood flow and oxygen to the injured area. It's something called scraping, Gua Sha, grassing. There's a million names online, but you can use any tool that you have at home, whether it's a spoon, the dull end of a knife, and I repeat, dull end of the knife. I use this grassing tool. I'm gonna put something similar right down here so you can check it out if you wanna get one. You're gonna take something oily like cocoa butter or olive oil, and you're gonna put it on the tool that you're using, and you're gonna just rub it on the side of your neck. From there, you're gonna scrape the side of your neck. I don't want you going too aggressive, just nice and easy, bring the blood flow to the area. Now, you're gonna maybe start to notice that one area is really sensitive. Stick to that area for 5 to 10 seconds and bring extra oxygen to the area. That's the tight area that you're feeling. Once you've done that, keep moving down that muscle. I really want you to kind of feel that you start at the base of your skull and work all the way down to the top of your shoulder blade. This should bring you a lot of relief. Now that we've brought blood flow and oxygen to the area, we're gonna get the nerve to start to glide past the inflammation. Whether you're just feeling muscle tension or you're feeling that severe nerve pain, this is a great way to get the area to calm down because the nerve is what communicates to the muscle to be tight, and you're gonna get that nerve to calm down a little bit. What you're gonna do is you're gonna take the side that is affected, so my right side is gonna have the pain, that same arm is gonna reach across your body, and as you do that, you're gonna look towards the side that has pain. And then you're gonna go back and forth, bringing your arm back, pinching your shoulder blade towards your spine, and looking the opposite way. Now, it's really important you stay out of pain. You don't wanna create more irritation. Nerves don't like being pulled on, and they don't like being compressed. So if you feel pain, just stay within a range of motion that you don't feel anything with, and then eventually you'll start to unlock, and you'll be able to do more range of motion, do 15 reps, and then move on to the stretching. Now that you're already feeling a little better, it's important that we get areas around your neck to start doing more work. So we're gonna start off with getting more mobility through the middle of your back. The middle of your back and neck play together. For example, if you're slouching at your desk, you can see how I'm only moving from one spot in my neck when you should be able to move from the middle of your back. So that's what we're gonna work on right now, okay? You're gonna be sitting back on your heels, hands slightly out in front. Really important, this is very important, I can't stress this enough. You fixate on one spot out in front of your hand and you don't let your head move. You're just gonna move from the middle of your back, round, and then stick your chest out. You see how my neck stays straight. You should feel a lot of pressure or a stretching sensation in the middle of your back. Go back and forth 8 times, making sure that you only feel it in the mid back. If you go to stick your chest out and you lift your head, it's gonna create more irritation. You can see how these muscles are doing a lot of work in this position, and you're gonna get inflamed and not subscribe to my channel, and I don't want that. So make sure you keep your eyes fixated on one spot. Now that we've worked on extension from the middle of the back, we're gonna work on rotation as well. Believe it or not, 80% of the rotation comes from the very first vertebra in your neck, but all the way down to the middle of your back helps with a little bit of rotation. So we're gonna loosen it up a little bit. You're in that same exact position, sitting back on your heels, hands slightly out in front of you. Now, the important part with this exercise is that your chin stays in line with your sternum. You're gonna grab your own stomach, pull across and rotate. Make sure that you're not looking up towards the ceiling. If you crank on your neck, it's gonna create pain and more inflammation, reversing everything we just did. So hold onto your stomach, pull your ribs, and feel yourself rotating as much as possible. You're gonna do 8 reps on both sides. From the other side, it looks like this, grabbing my own stomach and pulling across. Quick reminder, before we continue, if you're finding this helpful so far, please go ahead and hit that subscribe button. I post weekly tips and guided routines just like this to help you move better and feel better. And it supports the channel, allowing me to continue bringing you content just like this. We've provided relief by doing the scraping and the nerve glide. We've increased the mobility of the middle of your back to take some pressure off your neck. Now we need to strengthen the muscle that supports your neck, your serratus anterior. What you're gonna do is you're gonna be on all fours. Hands underneath your shoulders, knees underneath your hips. From there, you're gonna keep your neck straight. Don't lead with your chin. Keep that neck nice and neutral. Then you're gonna dip your chest and face towards the ground. With your keeping your arms straight the entire time. Now push away. That should get your face and chest away from the ground. Hold for a split second and dip back and forth 10 times. If this is too easy and you don't have an increase of pain or discomfort, you can tuck your toes, lift your knees off the ground, and do it in a loaded position. This is gonna get the muscle stronger even faster. Do 8 reps. Make sure you really push the ground away, getting your face and chest as far away from that ground as possible. Now we're gonna work on getting your neck a lot stronger. You're gonna lay flat on your stomach just like I am and get your face away from the ground. What I don't want you to feel is I don't want you feeling your lower back arching a ton, so keep your lower back nice and relaxed. As you bring your face away from the ground, you're gonna do 10 reps. This next exercise is gonna bring everything together. It's gonna work on teaching you how to get that mid-back more mobile and use your neck and mid-back together, which is super important, and strengthen that serratus anterior. You're gonna lay flat on your stomach. Your elbows are gonna be at your eye level. From there, you're gonna push your elbows down into the ground. That should make you feel like your chest is coming up. As you push down, make sure you keep your neck nice and straight. Don't look at the wall in front of you. As you're pushing those elbows down, stick your chest out. You should feel a really good stretch in the middle of your back when you're feeling this, but make sure you don't lift that chin. From there, you're just gonna really drive those elbows into the ground, and then you're gonna look up. You should feel the mid-back stretch intensify as you look up. And then you're gonna look down, and then you're gonna look to the left, and you're gonna look to the right. Every time you move, you should feel the stretch in the middle of the back intensify. This is teaching you how to use your neck and mid-back together and not be so rounded, only using your neck. Now, while these exercises often bring fast relief, there are a few red flags you should never ignore. If you're experiencing any of the following symptoms, make sure you seek professional help right away. Numbness and tingling traveling down your arm, muscle weakness in your shoulder, arm, or hand, severe and unrelenting pain that keeps getting worse. Also, if the pain doesn't start improving within 2 or 3 days, don't wait. Contact your local chiropractor, but make sure they prescribe you exercises and stretches. And if you're in the Orange County area near Cypress, we'd love to help you. I'll leave a link down below so you can schedule an appointment with us. Thanks for letting me help you today. It means a lot. If you don't mind hitting that like and subscribe button, it'd be greatly appreciated. And if you know someone else dealing with neck pain, please share the video. It would mean a ton. Until next time, keep moving and enjoy the rest of your day.